Joining me now is Dr. Lisa McGregor, Interim Chair, Division of Hematology Oncology at Penn State Health Children's Hospital. Thanks for being with us.
Thank you for having me.
Gabrielle was treated as a small child and is now a very successful young adult. And talk to us really about how treatment has changed or evolved over the past 20 years.
So there have been some great changes in treatment. We used to just use chemotherapy for everything. That really was the only tool we had. But now there are immunotherapies. There are what we call targeted therapies, where we use specific drugs that hit specific pathways in tumor cells. We have new forms of radiation therapy that benefit the patients. And so we really have a much larger armamentarium. For patients like Gabby, when I first started, I probably would quote a parent that maybe 25% of those patients would survive. And now I say 50%, which is, that's double.
That's huge.
We got a way to go, but it's been such a privilege to see that kind of improvement in my
that
lifetime.
is wonderful to see all the different types of treatment that are available. Now, we know that we will not find a cure for pediatric cancer without research, and really it's amazing what's happening there at Penn State Health Children's Hospital. Talk to us about that.
Thanks to 4 Diamonds and to THON, we have really been able to do a great deal of research. More excitingly is we rolled out this year an initiative for childhood cancer innovation. And with that, we are looking to improve the ways that we can diagnose children with cancer. We're looking for ways that we can treat them better. We're also looking for ways that we can improve their survivorship. In this initiative, we aren't just keeping it in our small pediatric oncology world, we're blowing out the walls. We are looking across all of Penn State and trying to harness all of the phenomenal research at Penn State. We have a granting program now where any researcher across the Penn State community who is doing research that will touch children with cancer can apply for funding so that we can look for cures and look to improve the outcome for our kids wherever those cures might be.
And we talked about treatment as far as the child is concerned, but we're also talking about treatment as far as the family. How wonderful is it to have all these different resources with 4 Diamonds, with THON, to really treat the entire family?
It is so amazing. You know, I like to say that at Penn State Children's Hospital, we don't treat cancer. We treat children with cancer and we treat their families. These are whole people, whole families, and they need a lot of support. Yes, we need the medicines to treat the cancer. That's number one. But after that, you need support for your spiritual help, for your mental health, for sometimes your financial help a little bit. And because of 4 Diamonds and because of THON, we can offer music therapy and art therapy and child life specialists and a dedicated chaplain, all to help children do better and help families do better as well. And those services, you know, we can't bill for those. Insurance doesn't pay for those. So without 4 Diamonds, without THON, without the support of people around, we can't offer those. So it is critical that we have that help so we can do the best for our kids.
Yeah, and it's really important for families, especially when they receive this news about a diagnosis like this. And finally, why don't we talk about just seeing kids progress, doing well, like Jackson's family. They're going to be attending THON for the very first time. That must be so exciting.
Oh, it's exciting to see kids do well. People always say, oh, how can you do the job that you do? But the job that I do is phenomenal. To know these kids and to work with them and to work with these families is phenomenal. But then to see them at THON, to see how much fun they're having, to see them not in a hospital setting, but just being kids. And I've got to say that the students of THON are so generous, not just with raising money, but they're generous with their time, they're generous with their kindness. They play with these kids, they have water gun fights, they're shooting silly string. They have a phenomenal time, and for me, it's just such a blessing to be able to see these kids be kids.
Oh, that is wonderful. We saw some wonderful video of them at THON. We'll see more, obviously, in a couple of weeks. So thank you so much, Dr. McGregor.
Thank you so much. Thank you again for having me.